Okay, let's have a look at all these videos that I've been tagged on. And now over here, one of my colleagues, she's doing a gum lift or gum recontouring. What do we do? Why do we do that? We remove the excess of the gum and make the teeth look taller. That way, it just basically creates symmetry. In this case, the patient has a snap-on denture. What is that? She has a couple of implants and the denture goes on top of those implants. And basically she says that she has removed all of her teeth. Now probably those teeth had issues, and then the dentist immediately placed some implants and again immediately placed some dentures. There are some questions on immediate implants because sometimes there's too much pressure on the bone and it can cause failure. But anyways, in her case, she seems happy. Now you have to consider the fact that with implants, you can get so many different things on top of them. You can get a removable denture, you can get a denture that's screwed in, so you don't have to remove it, which would be much more comfortable, and it would be, I think, much desirable for people. Nobody wants to remove the denture if they don't have to. And you can get bridges, so they can be screwed on every single implant, so you don't have to think about having them removed at all. Implants in general are really good options to restore a tooth. In this one, there has been a hole on the tooth. The patient didn't fix it, and the hole captured a lot of food and gunks in it. Now guys, I understand when it comes to fixing the teeth, especially if you do a checkup where your dentist tells you there is a cavity. Many people say, oh, but it doesn't hurt me. It doesn't matter if it hurts you, it can become this, it can become really huge. Now, this one, you're gonna see, first of all, the title is if this is real teeth or not. Clearly not, especially on the second tooth on the left side. There's a bit of pink porcelain to recreate the gum loss. But now that the dentist is removing the bridge, you can see how underneath there are crowns and one tooth missing. These crowns are holding the bridge together. The next one is a big cavity. So when there's a huge cavity on the side of the tooth, food gets stuck, gum gets inflamed. Now what's she playing with is just the gum. The gum basically puffed up. Now the gum has to be cut off. This one is a tooth that's completely broken and kind of glued to the next teeth by composite to hold it there. And this one looks really freaky, but it's actually a baby tooth coming off, and the second premolar is pushing it out. And in this, the patient has a lot of gold crown. The dentist is removing the gold crowns and replacing them by white crowns. The white crowns basically can be from porcelain, and they look much better than the gold. Oh, it's actually veneers. I don't think it's crowns. Yeah, so veneers go on the surface of the tooth rather than all around the tooth, but obviously white looks like teeth and gold is just gold. It's all cosmetic decisions at the end of the day. This one is a denture that the patient's wearing on top of her teeth. That won't be super comfortable. If you wear something on top of your own teeth, it won't feel right. This is removing a wisdom tooth. Now, wisdom tooth removal shouldn't be always difficult. So many times it comes out much easier than you think. Over here, the patient removed her back wisdom teeth, and the hole is just full of food. So she's rinsing it out and cleaning it for her. It is unfortunate, but it happens sometimes. If you have such a syringe, if you do it at home, if you just clean it yourself, it would be much more hygienic. So I usually give people syringes without needles. This is a lot of food stuck underneath the tooth and causing a lot of gum inflammation. So we go to the next one, a lot of calculus, a lot of build-up. This is very common. It's much more common than you think. We see a lot of these, and they are a lot of build-ups right underneath the teeth. On the lower, you get a lot of build-up there. If you don't remove them yourself first with flossing and brushing, and then go to the hygienist and get them clean, there's going to be, look how the teeth move and they are very loose. It's because they have lost all the gum around them because of all those gunks and build-up. The gum goes down like a house that doesn't have enough foundation. It becomes shaky, and so many of those teeth will be lost in the future. Not to mention that so many germs live underneath those calculus. I had one patient years and years ago. When I removed the calculus, we found a wire that was glued behind his teeth that completely came off with the calculus. He didn't even know. Over there is a wire. So imagine having a wire that gets dissolved inside calculus and build up, and somebody finds it and you're like, oh my God, I didn't even know I had a wire. Imagine how how long those build-up, those gunks, those germs have lived there. It cannot be healthy for you. Not to mention, it definitely causes systemic problem eventually. Gum disease has been associated with many kidney disease, liver disease, heart disease. So you have to remember that your mouth is connected to the whole body. Your mouth is actually the gateway to your guts. And if you have a lot of bacteria stuck inside these hard plaque and calculus, and you're eating food, you are swallowing a lot of germs that are not supposed to be there. Look how loose that tooth is. The dentist is holding it, worried about basically pulling it out together with the calculus. Unfortunately, that tooth has to go anyways, like it's a goner already, but I'm sure she doesn't want to remove it right now while the patient's still in chair doing a dental cleaning. It can really throw people off. I also had patients saying that, oh, you make my teeth loose, because it wasn't loose before. It was just swimming in between germs, and the germs were holding it together. You can't keep your teeth together with germs. And look at this big chunk of calculus. That's huge. And that causes a lot of bad breath. Oh, that's huge. So as I said, a lot of systemic disease. There has been a very recent study that associates a lot of systemic disease with oral hygiene and gum disease. And I think if more people knew that, they would definitely get more dental cleaning done. Look how loose that tooth is. That's basically, you go take an impression from this patient and the tooth comes out with it sometimes. So it's very important to make sure the structures that are supporting the tooth are healthy. Now, next, again, loose teeth, a lot of gum inflammation. Gum is red, gum is puffy, the patient's biting down and the tooth moves. Those teeth are gone. This one, the dentist is pushing on the gum, and from inside the tooth, like a volcano, a lot of pus coming out. That's because there is an abscess around the tooth. Now what's going on here? Oh, he's getting a bridge or implants, probably implants actually over there. He's missing so many teeth and he's getting dentures made. This one is my favorite. This dude is going to make his own veneers at home. So veneers cost a lot. I would say about $2,000 each tooth right now in Australia. And I understand that they're expensive, but I don't think, you might as well not get veneers and do this. So he's mixing hot water with plastic, white plastic, chewing on it, putting it on his teeth to get the form of the teeth. And when they get cold, they become white. And now he's going to shape them to the shape of his teeth. And he's gonna have cold water, so it gets kind of sets. This is, by the way, not how veneers are done at all. And spit it out. It looks not great. And now he's going to cut around his teeth and basically make it, mold it to the shape of his gums. And the thing is, you're gonna bite on this and it's gonna really hurt your lower teeth, it's gonna hurt your gums, food's gonna get stuck in it, and it doesn't even look good. Why bother? You might as well just not have veneers, have natural teeth, better than having these. I understand they must be much cheaper, but it's really not worth it. Look at that. It's just awful. Doesn't look like teeth at all. Each their own. But hygienically, it's not a decision I would make for my own teeth.